The World Health Organization (WHO) has warned sustained transmission of monkeypox worldwide could see the virus moving into high-risk groups such as pregnant women, immunocompromised people, and children. The World Health Body said it was investigating reports of the infected children, including 2 cases in Britain, as well as following up reports in Spain and France.
We're starting to see this with several children already infected.
Monkeypox has now been identified in more than 50 new countries outside the African nations where it was endemic. With cases also rising in Africa, the WHO is calling for testing to be ramped up.
While the emergency committee did not advise that the current outbreak represents a public health emergency of international concern, they acknowledged the emergency nature of the event and that controlling the further spread requires intense response efforts.
Cases of the virus largely confirmed in Europe are among men who have sex with men, according to a WHO tally. So far, there have been more than 3,400 cases of monkeypox and 1 death since the outbreak started in May. Last week, the WHO ruled the outbreak did not yet represent a public health emergency, its highest level of alert. However, the WHO's Emergencies Program Executive Director, Mike Ryan, said the World Health Body was tracking the outbreak closely and would reconvene the committee as soon as possible to assess whether it was still the case.